That Naturopathic Podcast. TNP.
Hello there.
Hi, and thanks for joining us. I'm Dr. Michelle Pobega, naturopathic doctor.
And I'm Dr. David Miller, ND, and we hear your frustrations. This show is for you.
This show is for you if you're feeling like your current healthcare strategy is not getting to the root cause or the underlying reasons for your health.
This show is for you if you've been told that you're fine, but you definitely don't feel very well.
This show is for you if you're walking out of your doctor's office with 1, 2, 3, 4, or even 5 medications without any mention of diet, lifestyle, or a long-term game plan.
This show is for you if you've got several specialists taking care of you, but no one is really putting all the pieces together.
This show is for you if you believe that health should be part of healthcare. These problems have solutions.
We know it.
Our patients know it.
And we want you to know it.
Naturopathic medicine is the solution that you should know about.
Welcome to another episode of That Naturopathic Podcast. Dr. David Miller, ND, and Michelle Pobega, ND. Oh, I should have said Dr. Michelle Pobega, ND.
It's fine. I'm not insulted by that.
Okay, sorry.
It's okay. I'm not that sensitive about those types of things.
Not that sensitive, although some humbling moments for both of us in the last couple of weeks, eh?
Yes. Yeah. So we both attended the Barral Institute courses. You were taking a listening course, and I delved into visceral manipulation level 1, which was, thank you for the silent round of applause, Dave. Which I was excited about just from having spoken to you personally and on a professional level, as well as a colleague of ours that has taken it as well. Tanya Lee told me about her ability to start using it and how it affected her patients, and she encouraged me to take this. So I was excited, and it was helping. Even with just pre-studying, I was starting to understand how there was more of a cause and effect with certain things in the body, and it helped create deeper connections about why what people experience doesn't always come from where they expect it to originate from, right? So a reflux problem isn't always a stomach problem. It could be a liver problem. It could be you know what I mean? Like a diaphragm problem. It could be, so it's just kind of helped reinforce some of those connections. And it was pretty awesome. Like every time she would talk to us about a case study, the teacher, or she would say, oh yeah, this happens, and that ligament of Treitz can get affected through whiplash, and then that gets pulled, and that pulls on the duodenum, and you're just kind of like, what? Nobody would ever expect to have to go look into the abdomen after a whiplash case. They just treat the neck, but nobody realizes like the chain of events in the line of command that happens and how deep that can go. So it was really I remember the girl that I was paired up with and we just kept like looking at each other being like, really? That's really cool. Like we had like little like mind explosion moments throughout the course. It was really awesome.
Well, the take home that we should share, fairly early here so that people understand maybe why we're talking about it, other than, just about our experience, which would maybe be more tailored towards practitioners. But what Michelle has experienced and I've experienced by doing this is and I don't want to put words in your mouth, but I almost felt like a grief of lost time, wasted time when I did these courses, because I realized, my God, we don't learn enough. And by we, I could say collectively primary healthcare practitioners, naturopaths, probably medical doctors in particular, who don't use the structural understanding, anatomical structural understanding of how the body works in your day-to-day practice of figuring out what's going on with someone, and then offering obviously some treatment options too. Basically what I'm saying is structure matters and biochemistry matters, whereas most of us practitioners are going to focus heavily on biochemistry. Like a doctor may have heavily focused on pharmacology, and a naturopath focuses on diet and supplementation, and then you go to this course and you go, oh my God, like you said, like I should have thought about the tilt of the liver might actually impact the tilt of the bladder, which is why you have problems with urinary frequency. You just don't think about that normally, right?
No. And it's interesting. I was just literally reflecting on this on the other day, being like, I've gone through 13 years now, post naturopathic graduation, of year after year taking continuing education credits, and not one of them Not one of them has ever been geared to the value of a physical assessment. There might be some things where they touch on stuff where they're like, physically they might present this way, you might have a heart, like there might be, but there isn't a lot of emphasis on that. It then just goes to that, here's the treatment plan with regards to pharmaceuticals or referring out, or here's the nutrition protocols. And it's just basically you sitting in front of a computer for a webinar or in a lecture room taking notes, and then kind of like trying to make sure your mind stays awake throughout this process. So going into a course that allowed me to apply hands-on work, to practice with each other, to have very dynamic discussions, and then to start to like assess the body in a way I, in 13 years post-graduation, never have. And in our practice, like in the course itself in CCNM, we didn't learn this. We learned like chiropractic adjustments, but I was just kind of like, I didn't feel confident leaving naturopathic college doing anything chiropractic. I'm like, I'm going to refer you to a chiropractor.
No, exactly.
And we did physical exam
and even
work.
chiropractic focuses on MSK.
Exactly.
And nerves.
So even physical exam work, like it gives us the mere basics to understand what's happening on a physiological level. So I don't know if I would say I have a grieving process, but I think there's a little bit of a disappointment that, or maybe even myself, that it's taking me this long to realize the need to make these connections. But obviously I went on this journey the way I needed to get to this point. And I think maybe that's why I have a greater appreciation or respect for what I'm now learning.
Humbling, right? Like
it is.
Look how, and it's big of you to go. I'm not here to pump up your tires too much, but it's big of you to go, because you go in to these Barral courses or very high end. I mean, I'm sure you can tell this is some high end anatomical understanding of the teaching, which then is applied in practicum. It's humbling as a naturopath to go, because we probably have the least palpation skills of anyone going in. So I'm gonna say you're brave, and you took on something it's hard to do, because it's almost more comfy to just be willfully blind to the idea that like there's nothing else to there's not another perspective. I know it all.
Yeah.
And it's a leap of I don't know, humility and everything that goes into accepting that, okay, anatomical structural perspectives are also important in the determination of what's wrong, i.e. assessment, diagnosis, and then offers some treatment options too. It actually makes you watch now. You watch your application of naturopathic therapies will be more precise.
Mm. Well, here's the thing, like,
and who doesn't want that?
In a classroom of, I don't remember how many, 1, 2, 3, 4, 5, 6, 7, 8, 9, I think 20 students. I think it was like 20 to 24 of us in total. I was the only person with zero hands-on experience. Everybody else, there was only one other naturopath, and she already had Reiki certification, craniosacral certification. I think she's had some other stuff where it required hands-on. So her hands were already and her palpation and her assessments were already much more sensitive than mine. And everybody else was some sort of manual therapist, if not already craniosacral or an osteopath or an RMT, and I was just kind of like, hi, it's me. Like, I felt like very much like a fish out of water. And that first day broke me. Like, by the end of class, you and I ended up going out for dinner that night. And I expressed this to you, but like by the end of class, we were trying to do our general listening and our local listening. And I just welled up with tears right before we had to practice general listening. And my partner just looked at me. She's like, are you okay? And I was like, I don't know what I'm doing here. Like, why am I like, I'm lost. Yeah. And she was like, it's okay. She's like, a lot of us are lost, even though we've done similar work. This is still new to us too. So it was a humbling experience, to say the least. And it definitely kicked me down a peg, and then I had to pull myself back up. But
and now you'll be so much better. You will, because you can remain willfully blind. Like now, when I look at, many of our, I look at, I don't want to say anything.
No, don't say names.
No, I don't want to say names, but like, people are often swallow up an ideology, or there's like a great overconfidence in their understanding of things being the way they are. And I would say it often has a lot to do with evidence-based medicine, ideologues. When I see someone who is an evidence-based medicine ideologue, like a disciple of that way of thinking, and they often trash naturopathic or other, maybe even more traditional osteopathic, subtle arts, or subtle sciences. There's an arrogance that is now, because you were humble enough to know that you didn't know everything. There's an arrogance that it really rubs me the wrong way, just because you're not doing your patients a service if you don't look into all the other options there are for perspectives and going about things. And you'll never know them all perfectly, but you need to know enough to know that you don't know enough, I guess. What I'm saying.
Well, the thing is I even liked when our instructor Kelly, who I freaking loved,
she's the best teacher I heard.
She's incredible. She's so incredible. And I did not feel bored once in class. Like, I felt fully engaged, which is a very true testament to her ability to engage a classroom and articulate. Because usually I'm like, oh, let's check my phone. So ADD kicks in hard. But even her, when she's showing us techniques before we're able to practice on each other. It was always the let go, surrender. She's like, release the need to succeed. And that was a very big thing she said a lot. And I feel like this need to be right, this need to know it immediately. And because she was like, the body will tell you, but you have to get your ego out of the way to hear what the body's telling you. And that is a very big part of this process. I had to learn to take my ego out of the way and then start to just be like, I don't know if I'm feeling things, but if I keep doing this, I'll start to feel the difference of stuff. And just be okay with that. And releasing the need to be correct or do it right. And they are gentle therapies and they can be quite powerful, but my I'm going to practice on patients of mine who I have a very stable relationship with, a very sound relationship, and there's a lot of trust and there's a good vibe there. And I'm already like planting the seeds, being like, hey, at our next appointment, can I practice this? Here's what I learned. And a lot of them are like, great, but I'm not going to just like jump onto everyone because I want to get better at this first before I just start doing it in general. And then there's some opportunities to go practice with some other VM1 graduates together a couple times a month within the GTA, which will be really great for me as well. But what I really liked about this was, even just with the introduction of the visceral manipulation, there's a quote in the book that says the purpose of visceral manipulation is to recreate, harmonize, increase proprioceptive communication in the body to enhance its internal mechanism for better health. We are not fixing things. We are facilitating the body to come back into a state of balance and harmony. And the real thing is that you cannot have life without motion. Everything has to move. And I think we get that. I think a lot of people realize that we have to exercise, and being stagnant is not good for health and this and that, but same with our organs. And I think we forget that there's mobility.
Where do you want your water from? A waterfall or a swamp?
That's just it, right? Like, do you want to drink, do you want to have it like from like a pool of water that's just gone mildewy, or do you want it from like a spring that's clear and clean?
Exactly.
So same thing. And I use that analogy for my clients. And I was like, if your organs can't move, they are more likely to start to acquire and hold on to garbage that should probably not be stagnant there. And then it makes the tissues more sick, less effective at function, etc. And so there's mobility within the abdominal cavity that every organ has to move with regards to each other. And how they affect each other, which is a big deal. And then there's also the organ's own mobility. And I knew about that part because of an osteopath that I work with, who was telling me how parasites will naturally deplete the motility of an organ. So I was interested in going into this course because of that knowledge already. And I was interested in going into this course because of my desire to help save gallbladders and learning how to support gallbladder health as well. But it just kind of reinforced things. So, a lot of things can cause motility and mobility issues, and infections are a big one. Mm-hmm. And people don't think that. They think once the infection is gone, you're like, yeah, you're cool. So this takes me back to our post-infectious IBS. You had an infection. Mm-hmm. Did it cause a restriction somewhere that then pulls on organs and then continues dysfunction in those particular sets of organs?
Yeah. And then, your restrictions may compromise blood flow to an organ, or
Nervous
congestion
system.
from
Yeah.
a nervous system and lymphatic. So
Yeah.
I predict it's going to be enjoyable but difficult for you, because it still
Yes.
is very hard for me to go, okay, is this a structural, anatomical driven issue here, or is it more like a biochemical kind of driven issue? And
Yeah.
the truth is, they sort of like probably play into each other a lot. Sometimes it's 99 to 1 and 1 to 99, or 50-50. So
Yeah.
I really encourage anyone who's a naturopath to seek out some hands-on work. And I cannot get
Yeah.
I cannot say enough about the Barral Institute in terms of the degree of the high level of teaching and anatomically based stuff with a high level of practical application.
Yeah. I mean, just for the audience, if one organ is stagnant, and I use this example often for my clients who have GERD, it might not be a stomach problem, might not be a stomach proper problem. What if it's a liver problem? And then I go to this course and it talks about how there's like the lesser omentum is connecting the liver to the stomach, and you can acquire adhesions in the lesser omentum. Or if the liver is not moving effectively because of maybe motility issues or a diaphragmatic issue or a ligamentous issue or something, then that shared lesser omentum with the stomach could then leads to pulling on the stomach. And then so the stomach mobility and motility is now affected. So not everything always comes from the place of origin we think it comes from. And just like you were talking about with a liver and bladder issue, there is a ligament in the liver called the falciform ligament that turns into round ligament, that turns into the umbilicus, then it turns into umbilical ligament, then attaches to the bladder. So if your liver's not functioning well, it could, by chain of command, affect bladder function, which is like mind blowing. Like,
Yep.
nobody talks about this stuff.
Why?
Right?
Because it doesn't fit their ideology.
Yeah, it's incredible to start thinking about the interconnectedness of the body. And I only took VM1, so I'm only learning about like general digestive organs. I didn't learn about the pancreas and the spleen. We didn't learn about how to improve the greater omentum and things like that. But we did learn about like the entirety of the colon, as well as like the valves and the different flexures. And, so I'm kind of excited to get deeper and deeper. I don't know what time frame I'm gonna be able to do all of that because they're not in Toronto, so it's not always convenient, but I'm very interested in continuing to connect the dots even further, because I can already tell like this is going to be a good stepping point, but it's not the full story because of the interconnectedness of things. You need to see the bigger picture to really start to, I think, create longer lasting results. And but I think this is definitely a stepping stone for a very new approach to how I practice naturopathic medicine and supporting health, which is very intimidating and very exciting at the same time. Like, that's how I say to the class, I was like, the class was inspiring and tiring, because once you leave, you're like exhausted. You're kind of like, you've practiced on each other, and then your body's tired, you're mentally exhausted. But it was super inspiring. I honestly, you nerd out hard. You're kind of like, this is incredible.
Well, for the patient listeners, we're talking specifically about what I think is what I know of is the greatest kind of physical perspective on clinically applied a clinical application of palpation and treatment. But the bigger principle is, in general, in medicine, and I don't know if this happened with naturopaths, we all work quite differently, but in general in medicine, I remember going to see my doctor when I was a kid. There was physical exam involved, I think, every time. I'm 44, so that's a while ago now. But there's generally been a decrease in the importance or value or practice of palpation in primary care. And I think it's to a massive detriment to patient care, because you are overlooking something that is a absolute wealth of information sitting right there, no cost. There's actually some therapeutic benefit probably just to palpation and touch and connection on a physical level. And we are absolutely missing in a love of technology or machines or CAT scans or MRIs, which have their place, and don't get me wrong, but we are compromising primary medical care by not palpating or knowing enough about the way to palpate and to sense things in the body. Patients are the losers if we don't do that. So we need to, no matter what kind of patient or practitioner you are, you need to get
100%.
a physical exam or some sort of, like, even if it's like not perfect, but some well-intended, curious in terms of like, I really want to understand what's going on with my patient, or if you're the patient, I want my physician or doctor or whatever to be very curious about what's going on physically in my body. If we don't do that, man, we're missing something big.
Yeah, and I will be the first to admit that like a physical exam doesn't always take precedence in my practice either. Like I'll do the basics and I palpate the abdomen. I always do that one because a lot of people are coming to me with GI issues anyways.
Mm-hmm.
But it's not of high priority because people have often so much to unpack verbally with me that it just kind of gets pushed along the wayside. So and that's something I've tried to become more conscientious of, to not just overlook that piece. And this will be my challenge moving forward because I'm a chatty Cathy and I'm not great with time management with patient schedules already. Like I'm always like probably going over a little bit with them and then I'm trying to like hustle to like finish their file before my next client. So it'll be interesting to see how I can integrate this into my typical structure of a clinical appointment. I know I'll figure it out. It's just going to be a bit of a learning curve to like shut my mouth and just like do some listening and visceral manipulation instead, and see how that goes.
Well, listening is the key, and I love that they call it listening. They say you listen with your hands, right? That's it's kind of a funny, kind of maybe a funny term, but I think the key. I'm just going to say it, and directly what I found, Michelle, that helps with trying to say, what do I focus on? Talking, listening with my ears or listening with my hands. I feel like, when you're doing your good job as a naturopath, you're listening to people with your ears and validating their experience. I don't like to overuse the word validating because it's, it can get a little bit overused, but well, what you're doing is you are connecting. And if you talk enough to connect, then it's time, I would say, to connect physically. But you need that connection. Yeah. And I think that will help determine how much you have to talk and how much you have to walk.
Yeah. So we'll see. It'll be an interesting, it'll be
good for everyone.
a fun little dance that I have to do with my time management skills. But I just wanted to let the audience know, like just the practitioners and just general listening and general audience at large to know what can cause restrictions and issues in mobility with your organs. So surgery and scar tissues, that's a big one. So again, people will be like, well, I had an abdominal ultrasound and they said all of my organs are fine. And I was like, that's great. Did you have any kind of surgeries done in your history? Because there could be scar tissue and they're not looking at that when it comes to ultrasounds. They're not looking at how that affects existing connections in associated organs. So surgeries, any kind of infection can also cause a lesion or within like the connective tissue of the organs, or like I said, can also affect the motility of an organ. Any kind of physical trauma, postural habits, emotional stress and emotions and stress. This is going to go down to like, somatic therapies and trauma care and fascial stuff and how like emotions can get stored in the fascia. Chemicals, so certain medications and pharmaceuticals, even herbs and vitamins and foods. Like sometimes if something doesn't agree with you, it could also start to lead to some issues. And then just repetitive stress. That was the list that they gave us. But I think most people don't really think of that causing adhesions, restrictions, and immobility on an organ system, and how that would then translate to dysfunction and symptoms, right? So I just wanted to bring that to people's attention. There was a patient in our class who had more than 4 types of abdominal surgeries. And she was a little bit heavier set. She had a bit of a bigger belly, and she had something called gastric ptosis, where your stomach starts to like sag and elongate, and it goes well past the umbilicus. Because usually your stomach, maybe it's really funny when you start putting this together and they start talking about the organs, you're like, that is a lot bigger than I thought. Like, how does that all fit in together in the abdomen? But so we did the assessment for gastric ptosis on her, and it almost went down to her pubic bone when the teacher was palpating for her stomach. And then that alone means that more food is further down in the pylorus of the stomach, the very bottom part of the stomach, and then to go back up to the pyloric sphincter, which is probably still higher up to reconnect with the duodenum. There's now such a great distance between that food might not be emptying effectively. So it's causing, heaviness after eating and all these symptoms that we don't actually think about being connected with like a structural issue. We just think, oh, I have GERD, let's take an antacid, or I have this, so we'll take a laxative, or you know what I mean? And then after applying doing the maneuvers, we remarked where the stomach, and it was I swear to God, it was almost like 3 inches difference that it was back to its normal positioning. 3 inches. And I was like, it's incredible the type of work that this will allow us to do to facilitate how people feel and how their bodies are able to show up for them. So that's just from restrictions from scar tissue. And that could also just be pulling the stomach down because of scar tissues in the omentum and in the mesentery and all these different things. Like it's wild.
Yeah.
It's pretty mind blowing. So anyways, I drank the Kool-Aid. I'm in it.
Girl.
I'm in it now.
Mm-hmm.
And I have already pre-signed up for committing to doing like VM2, VM3, VM4, and possibly doing this particular course again, so I can just extrapolate a little bit more, because I think that this will definitely just amplify what I can do as a naturopath.
It's patient care that you're going for here. That in the end, what you're signing up here for is you're humbly bowing down and saying, I know I can do better for my patients. And it's a great driver.
It's a new tool that I can implement. And if that means one less pill for people, that's easier for people's pockets. That's easier for their lifestyle. And I'm great with that. You know what I mean? Like, as long as the patient is supported and feels like there's a positive shift in their quality of life, their symptomatology, then this is nice to be able to have this now as, part of my tools. It's pretty
awesome. Most patients want to be palpated to help understand what the hell's going on in their body. Most symptoms have, not all, but most or a great majority of symptoms have the anatomical, physiological basis, but very few know it. And this helps you communicate with your patient, or if you're the patient, make sure you see someone who touches your body, like palpates and tries to be professionally curious about what the heck is going on, because there's so much there. And if it's not like the body's got the wrong signal. What does he say? Only the tissues know. So it's a direct signal from the body. It's like you got to learn the language of the body, and that's what you've just signed up, Michelle, to do, and that's what all doctors and clinicians should sign up to do, is understand the language of the body. It's on us to learn it. It's not like there's no information coming from the body. It's on us to learn the signals of the body. Like now when I touch people's I can feel nerves. I feel nerves, like there's a tingling. I literally feel like there's a buzz, like a 9-volt battery, and my hands are like wet and I'm touching. Like the body's got that signal for us if we're open to hearing it. It's like someone bursting in my room and speaking like, I don't know, like speaking Ukrainian. I don't understand it. It doesn't mean what they're saying is gibberish and silly. It means I need to learn how to speak that, and that's what you're learning to do, and it's a lifelong learning.
Yeah, I think it's I had a thought and I feel like I lost it, so I don't know, maybe we'll just wrap it up. But it is pretty exciting. Oh, this was what I was going to say. There are times where I've been in clinic where there are so many things that can have similar symptoms, and you know that the root cause can be from more than one, from various things, and there's a lot of overlap. And sometimes it's hard to differentiate one thing from another to know where to actually start treating things. And I think that this will be an interesting way to start to clear those messages, clear the path a little bit more, and be a little bit more specific and direct in understanding
clarity and simplicity is what you'll get.
Right. Yeah. And I think that will be really helpful, to just clarity, a little bit of clarity, right? To know how to best move forward for the patient, because it's not about me. Like you said. So that'll be really interesting to see how all this plays out, and I'm really excited to begin to implement this a little bit more. So Dave, thanks for bringing this to my attention, and just beating me on the head, being like, you should really take the VM course. So I'm in it to win it. I drank the Kool-Aid and I'm all in now. So
got a girl. Yeah. Good for you. Proud of you for doing it. It's a hard thing to sort of suck it up, and I'll just say, as I like to say, great thanks to all my teachers that I've had at the Barral Institute, and Jean-Pierre Barral specifically. Thank you for humbly bringing this work to the world. It will make medicine better the more people get on it.
Yeah, his passion for his knowledge and understanding and is wild when they talk about how he studies anatomy every day. He probably knows anatomy better than anybody in the whole world, but he still studies it every day.
He's humble. If you want to, he's very humble.
And I respect that.
Yeah, he's got grandpa power. He says less and means more, and he's very humble. And he's a pretty special guy.
It's pretty cool. Anyways,
okay.
That's our love of the Barral Institute and new applications to understand patient symptoms, and we're excited to bring this to our clientele. So thanks for everyone for listening. Have a great day.